recorded to this computer. All righty, folks. Good evening. Welcome to the 7 steps to starting your medical exercise training practice in any setting. I'm Dr. Michael Jones, president of the Medical Exercise Training Institute. I am a physical therapist. Actually, I'm a retired physical therapist now. And I've been doing this physical therapy thing. I graduated from Howard University in Washington, D.C. back in 1985. I was a young, dumb guy who went to school on an ROTC scholarship. I learned how to jump out of planes. Don't ask why. So I did that for 7 years in the Army. After I got out, went back to D.C. and I went back into private practice and have been doing that physical therapy thing. We did it for about 14 years. And then we started this program, the Medical Exercise Specialist. We started it because we saw then a trend toward insurance carriers cutting back on physical therapy services. Back in the early 1990s, we could get 26 weeks of physical therapy for a ACL tear. That almost overnight went from 24 weeks down to 12 weeks. So we had to figure out a way of getting those individuals out of the clinics faster and more effectively. So hence the MES program came about. We've been doing this now for 24 years. I've had the great opportunity of meeting tons of you all over the world from different places. And I thank you guys for joining us today. So forgive me, I'm going through and muting people along the way, but we're going to talk about these 7 steps. Now, folks, we've been doing this for 24 years. Let me tell you a little bit about me and why I think I can tell you this. After I got out of the service, I worked for a while in a couple of physical therapy clinics. I went off and did some fellowship training at some very well-known physical therapy clinics to kind of improve my craft. I then went to Australia, got a master's degree there, came back to the United States, got another master's degree, and then eventually got an MBA. Later on, I got a doctorate. But I was really geared toward teaching in physical therapy programs and orthopedic residency programs, which I did. I went back to Washington, worked at Howard University. I taught there for a while in the medical school as well as in the PT program. And I was director of sports medicine there for a number of years. So I had a lot of different pieces going on, and a lot of what we were doing dealt with the students. So in the early 90s, the Clinton administration came in, and they came in with the idea of health reform. What insurance carriers did, they started the health reform on their own, and they started cutting back on physical therapy services. Hence, we had to figure out a way of getting our clients out of the clinic faster, but managing them appropriately. So I wrote a series of protocols, 12 protocols, the original 12 protocols. Then we put together a program and started training medical exercise specialists. And hence, you guys are here 24 years later. So I guess it kind of worked. In those 24 years, I've helped MESs in every possible setting build their practices. So what we're going to do tonight is go over some of those 7 steps. Now, let me say this before we start. I have an idea, talking to MESs for 24 years, here's some of your concerns. The doctors aren't going to listen to me. I'm only a trainer. I've heard that one a number of times. Doctors are too busy. The insurance carriers are never going to deal with me. And folks, over the 24 years, I can tell you each one of those is 100% incorrect. Totally incorrect. So as we go through this, we're going to talk about that. But I know those are your biggest fears. The doctors aren't going to listen. They don't have time. Folks, they do, but you've got to make sure that you're talking the language they're talking and going at the speed that they're going. So here's what I'm going to ask you to do. Please write this down for me. And hopefully you downloaded the handout. Hopefully all of you downloaded the handout, okay? It's the 7 steps to starting your MET practice in any setting. Hopefully you downloaded that. Here's what I'm going to ask you to do. Stop thinking fitness. Stop thinking fitness. Start thinking medical exercise training, which means this. I want to ask you now to start thinking about conditions rather than thinking about just fitness. How do I manage these conditions with exercise? 1. Number 2, write this down. How do I help the doctor, therapist, and or chiropractor better manage their patients? What can I do to help them with that? And 3, there is an epidemic going on here in North America and around the world of baby boomers, me, that are aging, and we're aging because of all the dumb stuff we did, like jumping out of planes. We're aging, and now that's catching up with us. We're pretty spoiled. We want to do it 56, me, but I did it 36. I want to be able to hit the golf ball 200 plus yards. I want to be able to go out and exercise and do all those things, but with an arthritic hip, 3 pins in a hip from a parachute jump, and a bunch of other things. I can't do that, but exercise makes a difference. So this whole idea of medical exercise training, folks, is going to grow rapidly over the next 20 years because of the baby boomers and what you can do for them. So let's go ahead and get started with this. As I said before, I've been a therapist now for 31 years. I no longer practice physical therapy. I'm associated with a facility here in Houston that one of our MESs put together. I'm here actually helping him. And there's Glenn Maddox. Glenn, I haven't seen you in a long time, man. I hope all is well. Forgive me, folks. Some of these people I've known for years. So we're going to talk about these 7 steps. Here's the promise I'm going to make. If you follow these 7 steps, I guarantee you, not right away, it's going to take work, but I guarantee you within a year, you'll start getting referrals from doctors, therapists, and chiropractors. Please write this down. They don't care about your degrees. They don't even care about your title per se, because they don't know it. And the reason I know that, I did a presentation years ago at the American Academy of Orthopedic Surgeons meeting in Los Angeles. 646 orthopedic surgeons in a room. And we did a survey. You know what they said? They don't know your certifications. All they want you to do is know your scope, produce safe and effective programs, communicate, and produce outcomes for their clients. They could care less about your certifications. They don't know NASM, NSCA. They barely know ACSM. They don't know our organization because guess what? It's not in their realm. So here's my question. How many of you have been to an orthopedic surgeon in the last year and you had a procedure done? Did you ask the orthopedist where he or she went to school or who they were board certified by? Did you? No. You just wanted the outcome. Here's the deal. Write this down. It's about outcomes. That's all they care about. Can you produce the outcomes for my clients? Now, here's the thing, though. They look at you and the next fitness guy or girl the same way. They don't differentiate. And don't get ticked off by it. And don't say, well, the doctors don't know anything about exercise. No, because if they did, there wouldn't be any need for you. But with that, their lack of understanding of exercise is a prime opportunity for you. So we're going to talk about this thing. Please, if you would, for a few moments, just for the next, say, 45 minutes or so, focus just on this. And let's talk about how you can now use your fitness skills to transition into medical exercise training. Okay, I told you a little bit about me. So think about this. What would happen if you put a system in place or you started doing things that would allow you now to attract clients, communicate better with medical professionals, get more referrals? Would that make you feel better? I imagine it would, because I know what it is like as a trainer. You're always beating the bushes for new clients. The rent's due on the first. Mrs. Smith went away and Mr. Jones went away, and now how is this going to work? Okay? Here's the interesting thing. Have you seen very many hospitals close lately? Nope. Seen very many PT clinics close lately? Nope. Even with all this healthcare reform stuff going on, there is a huge amount of clients out there that need your services. You've got to now start thinking, how do I get them in my door? How do I service them and service their referral sources? So let's go ahead and get started. Hopefully, you can see my slides. Can everybody see the slides okay? Yes? Fantastic. Okay. Please, if you would, first thing, medical exercise training should not be used in lieu of services of a licensed rehabilitation professional. Okay, so when they are in the acute stages, they got swelling, all those red flags you learned in the MES course, send them off to the doctor, therapist, or chiropractor. That is one thing that we know when medical professionals are concerned about. Will you know when to appropriately refer? And when you do refer a client, write a letter of referral, give it to the client to take to the doctor, therapist, or chiropractor you recommend, so you get credit for that referral. That makes a huge difference. All right? So, real quickly, what is medical exercise training? If you took the MES course, you've seen this before. It's the development of safe and effective exercise programming for individuals with medical conditions. 3 primary modalities: cardiovascular training, strength training, flexibility training, and it's based on medical condition-based protocols, these medical exercise training protocols. Now, here's why that's important. Everything in medicine is based on a protocol, everything. Now, a couple of weeks ago, I was talking to some friends of mine I went to PT school with, and a gentleman there was an orthopedic surgeon that I guess I knew him in undergraduate school. He went to medical school, I went to PT school. And the thing we found was as we talked about it, everything in medicine has a protocol. Everything. Everything. But fitness doesn't. I'm going to need to mute somebody here real quick. My apologies. Give me just a second. And the thing that we realized was, if you are going to work in the medical realm, you've got to have protocols. Now, the protocol doesn't say you can't deviate. The protocol just simply says, hey, here's a guideline as to how you should do this. So let me ask you a question. If you went to Therese, I'll use you. You're in Southern California now, I think. Is that right? No, Las Vegas. I met you in Las Vegas. Let's say Las Vegas for right now. So let's say you tear your meniscus in Las Vegas, but you move to Boston. You should get the same care in Boston that you got in Las Vegas, shouldn't you? Roughly. The protocol says we're going to provide a standard of care across the board to produce an outcome. We don't do that in the fitness realm. That's why protocols become important. Please note that. If you're an MES out there and you're current with your certification, we're now using a new logo. This is our Medical Exercise Training Universal logo. It shows strength, cardiovascular flexibility training along with the stethoscope. We actually have these available that say medical exercise specialists around them. So if you're an MES out there, please email me so you can start using the new logo to let people know that you're not just a trainer, you're providing medical exercise services. We produced that 4 years ago now. And somebody now just took over. All right, you got to stop the video. My apologies here. We'll be able to edit those out. All righty, folks, as you come into the meeting, if you would, just simply mute your devices. That would be great. And let's see here. Got to mute one here. All right, let's keep going. Okay, medical exercise training. There's no treatment provided. Now, one of our competitors out there that we fought in federal court here in Houston is now telling trainers they can do treatment. Folks, I've been called 9 times around the United States as an expert witness by state attorney generals that have lodged charges against fitness professionals for providing medical treatments. You're not providing any aspect of treatment. You're providing augmentations to physical therapy and chiropractic care, and your goal is to maintain or improve the residual functional deficits. Please write that down, the residual functional deficits left after physical therapy, chiropractic, and medical care is done. Now, folks, when I became a PT back in '85, we could keep a patient in the PT clinic as long as we wanted. So when we discharged them, they were 100%. Nowadays, we're lucky if the guy can get up and walk with a walker and get out the door. It's the guidelines by insurance carriers. So now you're dealing with people that have greater functional deficits. And these conditions you're seeing include, just to name a few, osteoarthritis, total joint replacements, hypertension, diabetes, and lumbar conditions. And that number of conditions is just going to continue to grow. I guarantee it. So how did all of this start? I told you, we started in our clinic back in the Washington, D.C. area. It was a result of poor exercise programming done by fitness professionals, but also poor programming on the side of the physical therapists not doing good programs, inadequate communication between the two groups, the lack of integration of exercise in the treatment programs done by physical therapists, a lack of client understanding of what exercise they should do when we discharge them. There was very little research on the idea of medical exercise training. Folks, when we started the MES, there was no research that looked at exercise managing medical conditions or musculoskeletal conditions. That's what I wrote my doctoral dissertation on. And the program we put together was a response to try to bridge that gap. The gap is actually starting to be bridged a little bit, but in the beginning, folks, it was a huge abyss and people were just falling into it. And we still are seeing that, so we really need more MESs to open practices. Let me pause for just a second. The difference between a practice and a business, this is important. A business is always looking for new clients to bring in, put them through the business cycle, and then get rid of them. And when I say get rid of them, they bought everything, they're done. A practice, though, keeps providing services to a client as they need them. I'll give you an example. I have an eye doctor. I live now in Houston. My eye doctor is in Sacramento, California. I'm like, really? Yeah. This gentleman, Dr. Yamamoto, I started seeing him years ago when I lived there, and I would go in, get contacts, and he and I were both wannabe golfers. I'm a terrible golfer. I look good in the clothes, but I can't play worth a golf. He and I would sit there and talk about golf for the first 20 minutes of the appointment. And then we realized, oh, I'm getting my eyes checked. We would then do the eye exam, and I'd go out, get my eyes, do contact lenses. I wrote a check for about $200 each time. Good guy, enjoyed it. One time, though, I'm in Toronto, and I developed an eye infection. I called him in California. He says, hey, I can't write a prescription for you in Canada, but I have a good friend that I went to optometry school that lives there. I'll call him. He'll call you and take care of it. 20 minutes later, phone in the hotel rings. Guess what? Guy tells me to come over. I get some drops for my eye. I'm good. Guess who my eye doctor is for the rest of my life? When I get to San Francisco, I go see this guy. Please write this down. The idea of a practice is you managing my health and wellness for the remainder of my life. Now, I've got 3 pins in my hip from a parachute accident. I got an old ACL tear that now has become arthritic. And there's Tamara. How are you, Tamara? And as we go over those things now, guess what? I'm going to need exercise for the rest of my life. Please, if you would, write this down. What is the value? What value do I have to you over the remainder of my life? You're going to see me for the arthritic hip that gets replaced. You're going to see me for my knee. You're going to see me for my back because of my terrible golf swing. And at some point, you're going to see me for my mild hypertension, aren't you? Can you manage me over the course of the remainder of my life and help me actively age? As you're doing that, I'll come to see you for the hypertension. Hey, we're going to go away for a few months. We're going to come back. Oh, I'm going to have the hip replacement. You've now got to start looking at this from the standpoint of how you can help me with the aging process. So this whole idea was to bridge the gap, and this gap is going to get bigger and bigger. So who benefits? Clients. Safe and effective exercise gives them more function. Medical professionals. Integrating exercise into programs in a safe manner produces far better outcomes. Please, if you would, write down the word outcomes. Guess who else benefits? Insurance carriers. Folks, I've sat with large insurance carriers here in the United States, not the middle managers, but the C-suite managers. And they've told us they know exercise is important for what they're doing, but with that, they realize more extra. Oh, somebody's coming in and making a lot of noise in the background. I think we got you muted. So insurance carriers realize it's a good investment in the long-term management of conditions and wellness. And it helps the economy because it helps reduce our healthcare costs, both here in the United States, for our Canadian friends, even for our friends around the world. We're spending too much money on chronic diseases. So you guys are going to get busy over the next few years. So let's talk about the steps here. The first step, please, if you would, write these down. They're written out in your handout here, but if you would, write them down. The first step, hopefully you can read this reasonably well, is to establish a target medical marketing office. Now, I'm going to use myself as the example. Folks, when I opened my first PT office, I was very well trained. I had gone through manual therapy education at Michigan State, in Australia. I was considered one of the top therapists from the standpoint of manual medicine. So when I opened my practice, I could treat the patients. But I tell you, I was a hot mess. And when I say a hot mess, I couldn't pay the bills. I wasn't getting documentation done, which means I couldn't get reimbursement. And folks, I'm gonna tell you this, the first year, about 9 months in, I had to make the determination if I was going to pay my car note or pay my PT assistant. That's how much of a hot mess I was. One of my mentors, when I was a student, heard about what was going on, came over to my office, and he sat me down and he said, you know what, you need to start getting a system in place. And instead of running around talking to every orthopedist, you need to now start with a target marketing list. So number one, set up a target marketing list. What I find for most of our MES is as soon as you finish the course, you want to send out a letter to every doctor in the community. Not going to work. Number one, not many will respond, but think about it. Therese, I can see you here, so I'm going to pick on you. How many new clients can you take this week? How many new ones? Show me with your fingers, because I've got you muted. How many clients? 2, 3, 10, 12, 5. So you sent out a letter to Dr. Smith, Dr. Brewster, and Dr. Simmons. They like the idea. They start referring clients. And within a week, you got 8 new referrals. What are you going to do with those other 3? Well, wait a minute. Ronan is a trainer in the community, and the doctor can't differentiate between the two of you. So what happened to those 3 referrals? They went to who? To him. Please, if you would, Look at the idea of establishing a target marketing list by doing the following. Look at your current client or patient files. If you work in a physical therapy or chiropractic setting, look at the patient files. What I'd like for you to do is look at those files, also look at the surrounding community, and look at any medical professionals that have sent you referrals. That's your target marketing list right there. Those individuals. They already know about you. They already know what you're doing. They know the benefits of exercise because your clients have told them. So here's a question. How many of you have worked with the individual that has a total joint replacement, arthritis, or back injury, and they've gotten better as a result of your exercise? Yes, no, maybe? How many of you sent a letter to that client's doctor, therapist, or chiropractor? Really? You didn't send it. Why? Well, I'm just a trainer. They won't listen to me. Well, so the client went back to the doctor and said, hey, the stuff that Candy's doing with me is fantastic. I feel better. And the doctor's like, that's fantastic. But you never sent a letter or anything. Clients just on their own. So as a result of what's going on now, guess what happens? You never get a referral. And as a result, you don't now have any aspect of communicating with this doctor, therapist, or chiropractor in the future. So what you got to start doing is communicating with them. So here's how you avoid the shotgun effect. And the shotgun means you just cock that thing, I'm going to shoot at every doctor and therapist in the community. Not going to work. So if you would, focus on these three to start with. Now, you can substitute others in here, but start with these three. A general practitioner or interns. They're going to give you hypertension, diabetes, low back problems, arthritis, minor joint issues, all those things. These are the gatekeepers. This is the person you want to know. A chiropractor. We find that chiropractors are far more receptive to medical exercise specialists than any other medical group or any other medical professionals. What you do augments what the chiropractor does. And lastly, a sports medicine or physical therapy clinic. Now, notice we put them third. Now, how many of you have gone into a sports medicine or physical therapy clinic and you've got a little bit of, how would I say it? A little bit of attention when talking to the therapist? Well, I know you have. Yeah, a little bit of attention. Here's why we put these guys, sports med, physical therapy last. Now, I'm a therapist. Therapists have run into situations for the last decade of trainers going too far outside of their scope. So please, if you would, go after the general practitioner interns. And when you join our Mastermind Blueprint program, we're going to give you a script with regard to exactly what you say to that doctor, therapist, chiropractor. Go after the chiropractors, and after you've refined your presentation, go into the PT clinic. The first thing you want to say to the physical therapist is, hey, after you discharge them, I'll work with them, and if there's any problem, I'll send them back. Now, here's what I hear from therapists all over the world. And this happened to me. Back in the early 90s, before I started the MES program, there was a trainer in our community. Now, remember, personal training started in the early 90s that came to my office and wanted to meet with me. Fantastic. One day he comes in, my assistant put him on the schedule, he comes in, and he sits down and says, we're in the same business. We do the same thing. Guess what? We're doing the same thing. We're competitors. You need to move on down the road and get out of my office, and I'm going to do my thing. So consequently, what was my thought process about trainers from that point on? It was very what? Very dim. Very, very dim. So please, if you would, remember, sometimes the therapists have had bad experiences. So when you go in and do that presentation, make sure that you tell them exactly what your role is, what your scope is, and that you understand the red flags and will refer the client back if they need further care. And make sure you let them know you're not competing. You're going to work with a client after they've been discharged from therapy services. Also with step one, review any current client files or patient files if you're working in a rehab setting, and identify their physicians, physical therapists, and chiropractors. Write those names down. If the client has come in and you're working with them and they're showing results, that means the doctor, therapist, and chiropractor know about you. That's a prime individual to communicate with. Okay? Also ask yourself, which medical professionals have referred, either by an oral referral or verbal referral, or actual physical handwritten referral. And this idea of a medical advisory board, folks, it does not work. It doesn't work one bit, period. I've sat on medical advisory boards for health clubs. You know what I did? Every quarter they had have a lunch. I'd show up, eat the lunch, talk a little bit about the great things of exercise, and I'd leave going back to my practice with the idea, maybe I can get some patients from that health club. So please, if you're a club owner or you're in club management, the advisory board, not going to work. It does not work one bit. What does work is to look at the clients that are in your practice or in your facility, find out what doctors they're coming from, and then target those doctors. Because here's the great thing, exercise does work. And if it works, the doctors are seeing it. What you now have to do is capitalize on that. And we'll go over that a little bit more later. Step number 2, establish a medical exercise and post-rehab signature program. Now, like, Dr. Mike, what is that? A signature program is a program that you put together that's focused on the specialty area that you really feel comfortable with, that you can go to a doctor, therapist, or chiropractor that specializes in that area and say, Dr. Smith or therapist Mike, we have a program that specifically does this. For us here in Houston, we have a neuro program. It's a post-stroke program. So when individuals have strokes, after they finish with physical therapy and all that stuff, occupational therapy, the doctors refer them to us for an exercise program. We assess the client, we get an idea what they're capable of doing, and then we develop an exercise program around that. They come in 3 times a week. 2 times a week is unsupervised exercise. They're doing it on their own. Once a week, usually on Saturdays, one of our MESs works with them one-on-one to improve their strength and balance and stability, and then they do those exercises during the week. This program, please write this down, was a result of us asking a local neurologist what he wanted from us with regard to exercise. He said, I need a program for people who've had strokes. When Medicare cuts them off, Medicare doesn't allow therapy for months, then they renew them, but by the time they go back, they're back to square one all over. So we put together that signature program, and we market it to neurologists throughout the community. You can have a program for arthritic knees. You can have a program for arthritis in general. You can have a program for postpartum program. Whatever program you have, you want to do the following. And let me mute the cells again here. Whatever you want to do, you want to make sure you do the following, that you put together a program that's comprehensive. So you're going to promote your signature program. This is the program that you say, hey, doc, if you send these clients to me with these conditions, we're going to make sure we produce an outcome. So you're going to promote this to medical professionals, doctors, therapists, and chiropractors. You're going to market it to post-rehab clients utilizing social media. These programs or packages are finite, they're educational based and exercise structured. That means the following. Not only are they going to come in for exercise, but they're going to come in for exercise and also get lifestyle education. And along with that, the programs may be 8, 10, 12 weeks so that they're finite. They end, but guess what? You can have a level number 2 the client joins, and these could be group-based programs. So here's an example. We have MedFit group training programs. We have a dynamic back school, and that program takes up to 10 participants. They all must have undergone back surgery, had a disc herniation, or have chronic back pain. We market that to doctors, therapists, chiropractors in the community that specialize in lumbar issues. Those clients come in. It's a 30-day program. During that period of time, they learn how to lift, push, pull, carry, along with learning exercises that are specifically designed for lumbar clients. Second program we have is a total joint arthritis program. A lot of people are avoiding total joint replacements. They're arthritic. A lot of people have had total joint replacements. Physical therapy runs out. Where do they go? We lump them together in one program. It's a 30-day program. 6 sessions over a 30-day period. We do both lifestyle education and exercise. And when they're done, we give them an exercise program. We also open up our facility to them during that 30-day period so they can come in and exercise. What we're offering, and please write this down, is a solution to the doctor, therapist, and chiropractor with regard to managing certain conditions. That's why we call these signature programs. Think about it. We go to a local neurologist and say, hey, we've got a stroke program, but we also can take Parkinson's and MS in this program. They send those clients to us. Then they have a client maybe that has another neurologic disorder. We did so well with our signature program, they send this next client. But here's the interesting thing. The doctors all talk and communicate with each other. So if we have a number of these programs available, they work well. So we can use these as feeders to get clients into our programs. We also have a program for hypertension, diabetes, and obesity. For these three conditions, we pretty much manage them the same way. We market this program to endocrinologists, internists, general practitioners, and cardiologists. Again, these are 30-day programs. They're finite, educational-based, and exercise structured. So when the client finishes, they now can exercise independently. We've given them a program, but in many instances, they just simply decide to become a member here at Medical Fitness Pros or work with one of our MESs one-on-one. So that's the second step. Along with the second step, develop signature programs with medical professionals and their patients in mind. This is where I need you to now stop thinking fitness and now start thinking, what do the medical professionals and their patients need? Think in terms of diagnoses and conditions. I get a lot of MESs that call me and say, oh yeah, the client has a shoulder condition. In the medical realm, we don't say that. We say the client has a labrum tear, a rotator cuff tear. They've got bicipital tendonitis. We think in terms of specific diagnoses and conditions, because what that says to us, that's how the management process works. How can your programs help their patients? So if you want to maybe establish a referral relationship with an oncologist, one of our MESs called me a couple of months ago and said, should she take a cancer education program because an oncologist was moving into her building? Well, now think about it. I'm going to take a cancer education program. I don't know what this oncologist specializes in, but I'm going to take this program with the idea I'm going to help him or her. Maybe what I should do is sit down and find out what type of patients they have or their specialty and what program I can develop for them. So you have to understand their needs. So we understand your needs. That's what you're saying to the doctor, therapist, or chiropractor. And with that, you're developing programs around that. It now becomes an issue of you're offering, please write this down in big bold letters. You're offering the doctors, therapists, and chiropractors an exercise solution. Now, I was in private practice for 14 years as a therapist. What we strove for in our PT clinic was if we got a referral, we did only post-surgical knees, shoulders, and backs. That's all we did. If we had a patient that was referred to us with back surgery, I would tell the doctor everything they need from a rehabilitation standpoint, we're going to provide. They need a brace, we'll take care of the brace. They need to learn how to lift, push, pull, carry, we'll do the lifestyle education. They need modality treatment, we'll do that here. They need conditioning and strengthening, we'll do that here. What I wanted the orthopedic surgeon to think, or the physician to think, was when I refer them to Mike, their rehab needs are all taken care of. I get one solution. I don't have to figure anything out. Everything is taken care of. Please, if you would, start thinking from the standpoint of how can I take my exercise skills and expertise and help the doctor, therapist, chiropractor, and their patients produce better outcomes and have better functional capabilities. That's the major component. It's not about your certifications, folks. They don't care. They could care less. They don't care. I'll tell you, I've sat with orthopedists, they don't care. Can you give me a solution? Because right now, I've run out of things. I've done the surgery. We sent them to physical therapy. They're not getting any better. Give me a solution. That's what they want. All right? Now, the reason we're doing all of this, our Mastermind Blueprint program. I'm going to stay here for just a second. We put this together to help you, the medical exercise specialist, build a practice. Folks, if it wasn't for that guy, Kermit Gresham, coming by my office, some 25 years ago, I would have probably had to close. And I had all the skills. I had gone through all the advanced programs in manual medicine, had no idea. So we put together a similar program that gives you everything you need to build your practice. Profits, referrals, and outcomes. I know what's going on. I talk to you. I know you don't have enough clients. I know you're not making enough money. You don't have the systems in place. You're kind of hoping you get referrals. Stop that. You've trained too hard. You sat in that MES course and watched those videos of me. If nothing else, you should get a bonus for doing that. Let's help you build a stronger and better practice. So we got a Jumpstart program that's part of our mastermind group that starts June 26th. I'll come back to that. But let me ask you a question. Right now, honestly, how many of you would like more referrals with the medical community and you'd like to figure out a way to talk to more doctors, therapists, and chiropractors? Yes, no, maybe. Yeah. And you're like, I don't know what to do. Folks, I built 8 clinics over time. We sold them to Health South years ago. I made enough to retire on, but we started the MES and this thing just got bigger and bigger. I've sat with orthopedists, internists, gynecologists, surgeons, gotten to know them well. A couple of them I had as business partners. I can tell you how they think, and we've had probably every situation an MES can run into. We had a young lady contact me from San Francisco the other day. The physician that she's working for won't take out taxes in her check, and he says she's a contractor. By law, she actually is an employee. We gave her some strategies on how to kind of manage that. But the biggest thing is we want to see you get out there on your own and build your own practices. Not your own facility, but now instead of working in the health club and getting the chump change, let's be honest, going to clients' homes, we want to see you now start to build something that's bigger so we can build a profession that now has the ability to sit there with doctors, therapists, and chiropractors. That's always been my dream from the beginning. We need someone to actually fill that abyss and provide exercise services. We've got to have someone that does that. If we don't, we're not going to do this long. The therapist and chiropractor is going to fill that void. So let's talk about step 3. Develop an introductory letter and marketing kit. You've got to do that. Oh, we got somebody who's got their camera. That's Doris. Hey, Doris, how are you? Hope all is well. We've got to have someone now that can go out there and market to the medical community. So here's what your introductory letter should say. I'm going to make it real simple. Who you are, what you do, who you do it to, how you do it. You don't need nothing else. You don't need anything with degrees and all these special techniques. All that stuff to the medical professional is a bunch of garbage. They don't know it. They don't know about releases and all that kind of stuff and active release. They could care less. All they want to know is, hey, who are you? What do you do? Who do you do it to? Which means, who do I refer to you? How do you do it? Give me a general idea what you do. That's it. They don't want anything else. Medical professionals don't care about your certifications. They only care if you produce outcomes, period. Folks, I practiced in private practice for some 14 years. In those 14 years, I only had 3 patients that asked me where I went to PT school. You know why? I went to PT school at Howard University in Washington, D.C. The 3 of them were all Howard graduates. I lived in California, Michigan, the District of Columbia. Never had anybody ask me. All they wanted were the outcomes. They could care less. What I think happens in fitness is we get hung up on the certifications, but what you're really doing with the certifications is really impressing your colleagues, not impressing the clients. You impress the clients with the outcomes. Please, if you would, put together an introductory letter. If you join our mastermind group, we're going to help you write this letter. And it's all about who you are. My name is Michael Jones. I'm a medical exercise specialist, and I specialize in lumbar issues. I've been doing this now for 12 years. I work with spinal surgeries, including fusions and laminectomies, and clients with disc herniations. What do? I use exercise, including flexibility, cardiovascular, strength training, and stability training to help clients get back to their previous level of function. I do it to clients that have lumbar injuries, whether they're surgical or non-surgical. And how do I do it? We use a series of different types of exercise modalities. That's all. That's all they want to know. Along with that, give them a brochure, give them a referral pad. That's important. Give them a referral pad so now they can refer clients to you. Vitally, vitally important. That's step number 3. Also with step 3, these are the components of the marketing packet. You need an introductory letter. It should be no more than 1 page. 1 page. They're not going to read it. They're not going to read it. You should have a referral pad. The referral pad should be roughly the size of a quarter sheet of paper. A quarter sheet of paper, no bigger than that. Folks, I made a referral pad once for my physical therapy clinic. It was a sheet. It was the standard sheet of paper. It was color. It had all the modalities on it. So I asked an orthopedist that was a friend of mine. I said, hey, man, did you see my new referral pad? He kind of laughed at me. He said, yeah, I saw it. He said, I threw that thing in my desk. I'm not going to carry that brick around in each patient's exam room. He said, I want something that I can stick in my lab coat pocket, pull it out, sign it, give it to the patient, and move on. Please, if you would, when you develop these referral pads, they should be the quarter size of a sheet of paper. Make sure you put 3 in the packet. 1 to go on the doctor's desk or the therapist's desk, 1 they can put in their pocket, and 1 that sits at the nurse's station or at the front desk. And that right there is your biggest marketing piece besides your brochure. Business cards, a brochure that's real simple and easy, a flow chart, a medical exercise training flow chart from one of our protocols. Don't give the neurologist a flow chart for laminectomy. Give the neurologist one of the flow charts for MS or Parkinson's or stroke. Give the orthopedist the flow chart for total hip or total knee replacement. Also, let them know what your prices are. I get this question all the time. Well, should I let them know what their prices are? Yeah, because they've got to refer people to you. And here's what I'll tell all of our MESs. Have what we call a wellness initiative. A wellness initiative says, here's the price, but I know I'm going to get some people that probably can't afford my price. So I'm willing to allow them to come in at a lower rate, but I'm not going to do a discount. When you say discount, what happens to the value of your services? It does what? Goes down. You can't bring it back up. Medical professionals have done this for decades, and it's a good way of saying, we'll manage this individual, but with managing this individual, we want to make sure that we don't discount our services too much or too far. That becomes a big issue, a huge issue for most medical professionals, a very, very big issue. So we'll talk about that. Also, that signature program, have a flyer for it. Have a flyer for it. If you look at the back of the handout we have here, we've got a flyer for our medical exercise training one-on-one ebook. And if you hang around until the end of the program, till I finish the webinar, we're going to give you a free copy of this. I'm going to have you send me an email. We'll give you a code you use in the email to get a copy of this. It's a book we put together years ago. It's the 101 most common questions I've had from MESs, just like you, around the world on how to build their practices. The reason I mentioned this flyer is the flyer, if you've gotten your certificate from us in the last couple of years, we put this in the envelope. Have a flyer that talks about your signature program, your back program or your knee program. Send it to the doctor's office. And you know what? Send a bunch of them. What can they do? Throw them in the trash? But also put these out on your social media page, your Facebook page. Here's the deal. Here's what we find here in Houston. Clients that have medical conditions, well, somebody just got in the car. Clients that have medical conditions are out there looking for services. They're looking for services. And I'm here in Katy, Texas, which means when a client here is looking for something, they're going to go in, they're going to type in exercise total hip replacement, and the first thing the search engine is going to give them is our local services. The paid services will be at the top, but those are normally someplace else in the country. So what ends up happening is now the local service picks up, and individuals are on there looking for services based on what they need. Please write this down. The individual with a hip, knee, or back problem, whatever it is looking for what's in it for me. How is this going to make me better? That's all they care about, nothing more than that. So you've got to now start putting out your signature program in this marketing kit, which you can give to a doctor, therapist, or chiropractor. You take out the referral pads, you can give this now to a client, or if you're at a health fair, you can pass it out to those individuals at the health fair, but you got to let them know what you're doing. Don't be afraid to tell people what your prices are. And we're going to talk about prices at the end, so please hang around to the end. Step number 4, research the practitioner and practice before making contact. That target marketing list, find out what those practices are all about. Folks, we had 2 orthopedists when I lived in DC that did not refer anyone to physical therapy. So I figured, okay, let me do a little bit of research here. So here's what I found out. And we also had a neurologist, a neurosurgeon. Let me tell you about the neurosurgeon. I was the chairman of the physical therapy department at the hospital. And every Tuesday morning, we had a department heads meeting. I would sit down next to the neurosurgeon. And I knew the guy on a first name basis, talked to him, and he never referred patients to physical therapy. Never did. So finally one day, I'm at in another department at a meeting. My secretary pages me and says, give her a call. I call, Dr. So-and-so has referred a patient. What? The guy's never referred to physical therapy. The next week at the department heads meeting, I asked him, I'm like, Dr. So-and-so, you referred a patient. He said, I got tired of you sending me those doggone marketing letters. So I just said, here's a patient, leave me alone. So I asked him, we were joking about it. I said, why don't you refer to physical therapy? This is going to knock your socks off. He said as a resident now, this guy is the chairman of neurosurgery. He said as a resident, a physical therapist countermanded an order he wrote on a chart when he was a resident And from that point on, you didn't like physical. Isn't that crazy? Now, you say, well, wait a minute. How many of you have bought an item at a store, you didn't like it, you took it back, they treated you rude, and you're like, I'm never going in there again. But your spouse or your friends go in the same store. Ordinary people that went to medical school. So please, do some research on the practitioner. Determine the practice specialty. For instance, there's an orthopedist here I've known for years. He's an orthopedist, but he specializes in ankle and foot problems. Find out what the practice's specialty is. Find out who the office manager is. Please write this down. That's your best friend. The office manager is going to be your best friend. If you want to give a freebie away, free massage, I know Candy is on the call. Candy, if you want to give away a free massage, never give it to the doctor, therapist, or chiropractor. They'll never come. But the office manager will. And she'll go back and say, you know what? Candy did a really good job. Or if you open your own facility, the doctor's never going to come. No. The office manager will come, and when she or he gets back to the office, they'll tell everybody, hey, Dr. Smith, that was a really nice place that they have over there. I guarantee you. Now, how do I know that? I was in private practice for 14 years. During those 14 years I was in private practice, I would get invitations to do things. I would never go because I never wanted there to be the conflict of interest. But my staff members would go, and they would come back and tell me about it. Oh, wow, okay. Well, the next time we have an individual that needs this service, send them there. Simple as that. Now, let me share a little story with you. The first referral I ever made to a personal trainer, I didn't know the trainer. We had a young lady in the early 90s who was an attorney at the Justice Department in Washington, D.C. She had a shoulder surgery. She had gained a lot of weight after surgery because she couldn't exercise. So she asked me when we discharged her if she could go see a trainer. Fine. So she said, well, what trainer should I go see? I asked my assistant, I said, and this is what I said. We had a previous patient that worked with the trainer, and the trainer sent us a progress report. Never met the trainer. She sent the progress report. I read it, signed it, put it in the patient's chart. I asked my assistant, I said, you remember Mrs. So-and-so, the trainer that wrote that report? Find the chart, find the trainer, and refer Mrs. Smith there. Never met her. Never did. But I figured if she had enough wherewithal and professionalism to send the progress report, that's who I wanted to refer to. So she sent the progress report to the office, just to the office. I read it because every piece of material that comes into the office, if I'm the professional, I've got to sign off on it. Now, I didn't make the referral. My office manager did. Find out who the office manager is. First name basis, because folks, for 14 years while I was in private practice, I would go into a doctor's office just to say, hey, how you guys doing? I would sit there, talk to the office manager, the front desk staff. The doctor might walk by between exam rooms. Hey, Mike, how you doing? But everything I needed, getting forms signed, getting documents taken care of, it was all done by the office manager and the staff. And lastly, determine the most client-patient type they have in that office and gear your programs toward that patient type. Don't put together a program for some obscure condition they only see once every 2 years. You're going to miss the boat. Look at it from the standpoint of the 80-20 rule. 80% of that individual's revenue is going to come from 80% of the patients. Don't worry about the other 20%. Look at the majority. Now, over time, you can work with that small group, but you want to look at the majority. So ask the doctor, therapist, or chiropractor. Ask the office manager, what do they specialize in? That takes us now back to this mastermind. We got a bunch of bonuses for you. Now, everything that we've gone over to this point, we go over in the mastermind in more detail. Bonuses. You've probably seen this already. You're going to get that ebook we talked about. You're going to get a copy of that. Our MedX Pro Summit we have right here in Houston. Every year, it's probably the biggest gathering of MESs there is. We get that. It goes on here November 30th through December 2nd this year, right here at our facility in Houston. You can see a medical exercise training practice as it works from start to finish, top to bottom. We'll show you everything. Come on down, and guess what, folks? If you're one of those diet persons that eats like whole foods, which is cool, when you come down here, we're going to give you some good Cajun food for a couple of days. You'll enjoy it. Next, we're going to give you a series of administrative forms. There are 20 forms in the packet that range from assessment forms to progress reports. If you want to really build a practice, you got to have those things. You get that. lifetime membership in our MedX Pro network. That MedX Pro network is geared toward helping you build your practice, and you're going to get 2 one-on-one coaching sessions with me. Total value about $1,500. We make that part of the program. Now, that takes us to step number 5. Make the presentation. This is where a lot of our MESs get squirrely. You got to make the presentation. You got to go in there and talk to that doctor, therapist, chiropractor, or the office manager. You got to make a presentation. Bottom line. Now, folks, for our facility here in Houston, we don't use my physical therapy license or anything. I would go out and make marketing calls to the doctors and talk to them about our medical exercise training program. In many instances, I had to take lunch. To get all the folks in the office to sit down, I had to take lunch. Okay, well, what possibly could happen if I took lunch and they started referring clients? Was a $100 lunch worth it? Yes. So let's do lunch. We took lunch into the office. We talked to them about the most common clients that they saw in their office in that presentation. We talked about the outcomes that we produced. We talked about how we would communicate with them. We talked about how we would design programs, and we did not talk about our certifications. They don't care. Period. They don't know them. They don't care. Period. Don't even talk about it. Let them know, yeah, I'm a medical exercise specialist. Let them know I'm a massage therapist. Let them know I'm an RN that does all of this stuff. Yeah, they can care less about your certification. They care about, can you produce outcomes for the type of clients or patients I see? Will you communicate with me so when the patient comes back after I refer them to you, that I don't look like a deer in the headlights asking Mrs. Smith, well, what is Therese doing with you? Folks, let me ask you, how many of you have clients that could accurately explain to the doctor, therapist, or chiropractor what exercise you do? None. None. Maybe what, a handful? I saw somebody say maybe 1 or 2. That's it. So if you don't send a referral back or a progress report back to the referral source, have you actually now breached a professional confidence? Yeah, you have. So think about this. Several years ago, I tore my rotator cuff. A friend of mine here in Houston examined me, and with that, he sent me off to get an MRI. Well, I went over, got the MRI, paid for it and everything. Went back to see him. The MRI report hadn't come in. So that means I lost the visit, which I had to pay for. The doctor lost the visit because they didn't send the report. What happens when the doctor refers a client to you and you don't follow up with the progress report? The doctor's like, why did I do this? I'm not doing it anymore. So you got to send those progress reports. So you got to communicate. Tell them how you'll communicate. We've had some physicians here at Medical Fitness Pros that refer to us. They want us to communicate with them by text. Some prefer fax, some prefer email. It depends. Some ask us to hand deliver progress reports. Just depends. Talk about your program design, not your certification. They can care less. Step 6, complete the medical exercise specialist training. Now, obviously I'm biased, but here's the key thing. We're getting a lot of knockoffs that are popping up out there, folks. And I'm sorry, when we put the MES program together, we put it together from the standpoint you would be able to sit in front of doctors, therapists, and chiropractors, be able to explain the pathology or the anatomy of the client, put together an exercise program, know the red flags, know what was indicated, contraindicated, and be able to work that exercise program and manage the client. So you now were a colleague instead of being just a person doing the exercise. That's what we trained you for. And most of you will say the MES was pretty difficult. So get training, even if you don't do our MEST program. Get training so you understand clinical anatomy and pathology. You understand medical exercise training protocols and guidelines. You can identify the inappropriate client with red flags, and you use some type of protocol-based exercise management. We're seeing too many fitness professionals that are doing so-called medical fitness, and they have no guidelines. They're making stuff up. I had one girl call the other day and said she read a book, and based on reading the book, she now was developing exercise programs for clients with a rather interesting type of total joint replacement. So to give you an example, years ago, when I was in graduate school at Michigan State, while I was in undergraduate school, I read a book by a guy named John Monell. Dr. Monell was one of the preeminent manual therapists at that time, in the late 80s. When I get to Michigan State, I meet a guy named Carl Steele, who works for the dean, and Carl and I eventually become roommates. So what happened was, there's Angela. Hey, Angela, how are you? Carl and I become roommates, and Dr. Manel comes to Michigan State to speak. He gets me into a reception where I can meet Dr. Manel. I have my book, and I get up the courage finally to go over and ask him to sign the book. So he signs the book for me. He's a big British guy, really big guy. And he's laughing. He's a real jolly guy. So finally, I get up enough nerve to ask him a question. I said, Dr. Manel, I think the concept that you have in your book, now I'm trying to be real professional. Dr. Manel, the concept that you have in your book about a half-inch of joint play, I think is amazing. And Dr. Manel says, no, my boy, that's not what it means. It means that there's an eighth of an inch of joint play in the joint period. I thought he meant on both sides, which meant just simply reading the book without the master or the instructor to explain it to me when I have no background. No, you're dealing with somebody's mom or dad or someone that has a medical condition. You can't just read a textbook. And folks, having taught in medical schools and PT schools, no, you've got to get the appropriate training. Now, there's plenty of training out there that you can get. You can go to our MES or someone else's, but make sure it's comprehensive and detailed. Please, if you would, write these things down. If you can, take a good anatomy course that if you can, do some cadaver work. 2, if you can, get into a physical therapy clinic and observe as much as you can, especially the assessment procedures. There's a lot lost when we're doing fitness-based programs that don't have a strong medical component, especially in the teaching aspect. I'm not saying they're bad, but we're losing something along the way. And I see this all the time with individuals taking our MES course, which takes us to step number 7. Establish a medical communication flow. Folks, you got to start communicating with these doctors, therapists, and chiropractors. You must. You've got to. You've got to have some type of assessment summary. So when that client comes in, within 72 hours, you're sending a one-page summary of the assessment to the doctor, therapist, or chiropractor to say, here's what we found, here's what we're going to work on. 2, you've got to have a progress report that you send to that doctor every 30 days. Now, here's the deal. Some of you will say, well, the client came in on their own, the doctor had nothing to do with it. The client walking in the door now gives you leverage over the physician. You say, well, why? Folks, in 2018, especially here in the United States, and I imagine around the world, the American public is having a dialogue about insurance coverage for healthcare. Americans now are saying, hey, we want something that's going to keep us well and keep us functional. They're concerned now. They're asking more questions of their doctors. They're challenging their doctors and hospitals and insurance carriers. So when that person walks into your practice, you can easily say, hey, I'd like you to get a signed referral from your physician and come back. That client who's walked in your door initially says, okay, I'll get the doctor to do that. So they go see the doctor. There's nothing wrong with them. So the doctor signs off on the referral and they come back for the exercise program. So they come back for the exercise program, and guess what? The doctor signed a referral, which now gives you a means of communicating with him. You send your progress report. Here's what happens when that progress report gets into the doctor's office. It's attached to the client's file. It's then put on the doctor, therapist, or chiropractor or nurse's desk that's managing that client, because all correspondence coming in must be reviewed. They review the correspondence, and guess whose name is at the bottom? Therese Schilling. Excuse me. Guess whose name is at the bottom? That's what they do. And it's a simple progress report. They review it, put it into the chart, they're good to go. You've got to start sending progress reports. Along with that, discharge summaries. When the client is done, let them know, okay, Mrs. Smith is finished with her medical exercise training. Now they're just going to do a fitness program with us. Send that out. Also, make sure follow-up sessions for your clients, you have at least 2 scheduled in advance. So if you do have to communicate with that doctor, therapist, or chiropractor, you can tell them, we've already got Mrs. Smith or Mr. Jones in the system. Here's what we've got planned for the next 2 sessions. What do you think? And lastly, here's the big one. Regular communication with medical professionals. You got to figure out a way to communicate with them on an ongoing basis. Blog posts, if you have a blog. Maybe you ask a doctor, therapist, or chiropractor to communicate. Now, I think on the call this evening, we have one of our MESs that went to medical school. I'm not sure if he was able to make it. He's about to start his internship. Eton Coach. Eton took our MES course in New York City back in the late 1990s. He ended up going to medical school at Howard in Washington, D.C., my alma mater. We've stayed in contact over the years. He just finished medical school and he's starting his internship in New York City. The reason I bring this up is, as a physician now, he understands the importance of correspondence in helping manage the patient/client. We talked about this in detail, and he said the one thing that he wished he had done better as a medical exercise specialist when he was doing that for medical school was to communicate in a written manner more effectively with the doctors, therapists, and chiropractors, because he felt like that would have made a difference. Please, I understand that you're concerned about this. We're going to show you how to do this in the Medical Exercise Mastermind Blueprint. We're going to give you guidelines on writing discharge summaries, progress reports, and assessment summaries. We're even going to give you examples. Because, folks, here's the deal. This whole medical exercise training thing is going to get bigger and bigger over the next 2 decades. Whoever lays the foundation now for their practice is going to be the ones, or will be the ones, that will now reap the benefits of 5 years from now when insurance carriers start paying for this on a more regular basis. Doctors recognize the need for this because, folks, I'll tell you, more therapists are calling us to take our courses, more nurses are calling us to take our courses, and more concierge-based physical therapy and medical clinics are now hiring trainers to provide those services in-house, which means you get cut out of the deal down the road. So please get started with these steps to build your practice. Now, the MET commandment, manage the condition and train the client. What that means is the following. If you're in Houston, Texas, or you're in Seattle, or you're in Quebec, Canada, you got a total hip replacement client, the exercise program should be roughly the same, shouldn't it? If it's an anterior approach hip replacement. What changes, though, is if the client can only come once a week, or maybe the client has hypertension also, or maybe the client has an amputation on the other side. Now we're managing the primary condition, but we're training the client based on their needs. This is the ultimate commandment for our MESs. And please let the doctors, therapists, chiropractors, and your clients know we're going to look at a standard guideline. That's why we gave you the protocols. But you're going to take those protocols and modify them to meet the needs of your clients. So you aren't handcuffed by the protocols. They actually give you more flexibility. Which now takes us back to the Mastermind program again. We're going to give you the Mastermind program itself is $800. If you register for the program, we're only going to charge you $600. We got an early bird registration fee. Now, some people say, man, $800 is a lot of money. If you're able to establish a referral relationship with one medical practitioner, how much is that worth? Now, and let me say this. One of our Mastermind members from the past actually became a provider with an insurance company. That doesn't mean it's going to happen to you, but it did happen. And we also have had a number of them that now are getting referrals. So let me look at some of the people on the call here. Yuli Balani. Where's Yuli? I've gotten to know Yuli pretty well. Yuli is one of our MESs in New Jersey. I think it's Chester, New Jersey. I may be wrong about that. But I visited Yuli's facility. He's in the independent living facility. And Yuli works right alongside the therapist there. He actually sees clients that are independent in the facility. They're still ambulatory doing their own thing, but they come to see him for exercise. He's now got 3 staff members that work for him, all because he figured out how to market his services and put a system together. Let me tell you about some others. Phil Godfrey and Don Allen. Now, these 2 guys are real interesting. They took the MES course while they were working at a health club in Washington. They now have the first, as far as I know, the first, I guess, multi-regional medical exercise training practice. They have an office in Atlanta, where Phil is located, and an office in Washington, D.C. 2 separate offices, same practice. It's called Medical Exercise Trainers. Go look them up on the internet. They finished the MES course and also went through the Blueprint program. And they come down for our summit every year and share information. Amanda Harris, she couldn't be with us this evening. Amanda owns Reconnect in Richmond. She gets referrals from one of the top manual therapists, physicians in the country, osteopath, and I think she's got 5 staff members that now work with her. The reason I bring this up is because they all went through the Blueprint program. And the only reason we put this together, folks, was so that you can now start building practices. I have to be honest, it hurts to hear our MESs are out there and they're barely making it. They're working in health clubs, and the health club managers and owners are really treating you badly Whereas if you just took the time to put a system together and then started really working with the medical community, you could reap the benefits of it. So that's why we're putting this together, and that's what I'm concerned about. We've been doing this now for 24 years. I'm not concerned that we certify more MESs. I'm more concerned that we help you guys now be able to establish a good lifestyle, establish a level of professionalism, and not have to go to these clubs and be treated just like any other trainer. You don't deserve that. You've done too much, and there are too many things you can do to help your clients. So let's talk about pricing real quick. This is a bonus that we're going to include in the program. It's a bonus for you guys, not for us. Pricing. Please establish a distinct MES pricing schedule for your practice, or MET pricing schedule. Don't charge clients that are coming with medical conditions the same rate you charge to fitness clients. Don't. You're selling yourself short. Here's what we recommend. Medical exercise training requires a different approach and a different management skill. For MET sessions, we recommend charging as high as 20% above the going rate in your community for personal training. So if a client has a medical problem, they're coming into you for exercise regarding that medical problem, whatever the going rate is for personal training sessions, we recommend you charge as high as 20% above that. The reason? You've got to work with this client, you had to go through additional training, and more importantly, you've got to communicate with that doctor, therapist, or chiropractor. For the assessment, which is where you really show your knowledge, for the assessment, whatever the going rate is for a personal training assessment in your community, you should charge 25 to 50% more. Reason? You got to send reports to that doctor, therapist, and chiropractor. You got to write them up. You got to sit down and formulate the program. This is what you should get as a medical exercise specialist as a professional. We want to stop seeing you compare yourself to personal trainers. No, you can do far more, and we've seen this over the last 24 years. So with that, last point here. Now, this is a bonus that we decided to add at the last minute today. The 5 keys to MET reimbursement. Now, at our facility here in Houston, we do not use my license. I'm not even licensed to practice physical therapy here in Houston. I retired years ago. But we wanted to start looking at insurance reimbursement. For some clients that come into our facility, I don't see them, I don't sign off on them, I don't do anything with regard to physical therapy. We're getting reimbursement for those. We have one of our MESs, our MES of the year last year, Susan Connor. She lives in Charlotte, North Carolina. Susan became a provider for an insurance carrier. That means she's on the provider list. Clients are referred to her, she completes the services, she bills the insurance company, she gets a check. Folks, I don't care what certification you got. When you now can start getting revenue like that, that makes a big deal. That allows you to grow a practice. She did that as a result of our Mastermind Blueprint program. And let me say this, we helped her with the guidelines, we helped her put everything together, but she did a lot of it on her own. She will be one of our guest speakers at these Blueprint programs. So if you're looking at insurance reimbursement, just to kind of give you an idea how this works, the criteria to even begin to talk about getting reimbursed from an insurance carrier is the following. You have to have a written referral from the physician. That's why the referral pad becomes so important. The client must have undergone or sustained a major trauma, undergone surgery, or have a long-term condition. Example, they've had a disc herniation or a fractured femur. They've had a laminectomy or ACL reconstruction, or maybe they have MS or Parkinson's or maybe even a stroke. Next, they've received the maximum benefit from physical therapy and chiropractic care. So they went through all the PT. They went through all the chiropractic. So we're not circumventing that, but now they realize we need a good structured exercise program. Please write this down. The Quebec Task Force Study. The Quebec Task Force Study. Send me an email and ask me to send you a copy of the Quebec Task Force Study. What this study basically said was, it was done back in the 1970s. It said that for the most part, for individuals that have sustained musculoskeletal injuries, the first 6 to 8 weeks of care should be more modality-based. Hot packs, cold packs, electric stim, all that stuff. After that period of time, the most important component was what? Exercise. That's why physical therapy clinics and chiropractic clinics get the standard letter from the insurance company. 6 to 8 weeks is reasonable and normal for physical therapy or chiropractic. They cut them off because at that point they know they need exercise. This justifies your existence, which says they've gotten the maximum from PT, from chiropractic. They now need a good structured exercise program that's protocol based. The client, next criteria, they have residual functional deficits. Now, we'll talk about residual functional deficits in the Blueprint program, but what we mean here, they have deficits in endurance, flexibility, stability, strength, coordination, balance, any of those things. Maybe even some residual pain. So they've got residual deficits that now affect their ability to go back and be functional. And lastly, Medicare, Medicaid, or any government insurance is not going to pay for your services. So if you're trying to get something through Medicare, ain't going to happen. Medicaid, not going to happen. Those two programs here in the United States are almost broke. Now they're going to start paying unlicensed individuals. I don't think it's going to happen anytime soon, or if they do, it'll be in a very limited manner. For our Canadian friends, BC Med, OHIP, those types of things probably aren't going to pay, which says things like this. Third-party carriers are going to be your best option. Third-party carriers. We got a little bit of noise going on here. Third-party carriers. Third-party carriers. Things like Blue Cross and Blue Shield. Things like Blue Cross, Blue Shield, Aetna, Cigna, things like that. Okay, but Medicare is not going to pay for the service. They're just not going to do it. Okay, Medicaid, Medicare, they're not going to do it anytime soon. Okay, now this we think is the future. Now let me say this. You know what physical therapy was some 40 years ago, back in the well, I guess I should probably say 50 years ago now. Back in the 1960s, we were in the basements of the hospital. We were considered the jocks in the hospital. We put together crutches, we used walkers, we did some exercise. We were in the basement of the hospital. Then somewhere along the way, people realized, hey, physical therapy was important, but we had to actually do research. And the research now, we took that research to the insurance companies to say, hey, this stuff works. They then said, okay, if it works and it gets patients out of the hospital faster and makes them more functional, we'll start paying for it. Once they started paying for it, a few therapists trickled out of the hospital and opened their own PT clinics. I talked to a guy once who opened one of the first private PT clinics. He said back then, Medicare paid him $4 for an ultrasound treatment. And you may say $4, but back in the 60s, that was huge. Those individuals, when they left the hospitals and went out on their own, they had their own brick and mortar. We're not saying you have to do brick and mortar, but something where you have a sustainable income based on the professional services you provide. That then was the basic catalyst to grow a profession that now is known around the world. Okay? They didn't do anything that was spectacular. They just simply said, there's a need, we're going to fill it, and then they found a revenue source. Folks, from my standpoint, I don't know, a lot of you say, I don't want to deal with insurance companies. Granted, that's why I sold my practices. But I also do know this. It's hard to find clients that can fork out 50, 60, 70, 80, $100 for your sessions. And at some point they say, you know, I need to kind of take a break. Something came up. Right or wrong? Yeah. But if maybe 30% of your clients you get reimbursement for, even if it was only 50%, wouldn't that make you happy? Yeah. So I'm not saying this is going to happen right away, but I'm saying this is what we've got to strive for, which means we've got to have standardized guidelines and protocols and produce outcomes. It can't be about, oh, Mrs. Smith, you just feel better. And we've got to communicate with medical professionals better. We've got to put systems in place. That is vitally important. Which says, again, join our Mastermind Blueprint, okay? We've got all these bonuses here for you to help you build a practice. And remember, practices, it grows beyond just you. You've got systems out there, marketing systems, management systems that now attract clients to you. That becomes important. Again, we've got this early bird registration that goes on until June 19th. The Mastermind itself starts on June 26th, okay? It's a 8-week program. It'll run until the end of August. And you know why we did that? Because come September 1st, Labor Day, everybody hits reset. What I mean by that, they hit the reset button and say, okay, all those New Year's resolutions I didn't do, I'm going to try to get in shape again. Isn't that right? Yeah. Everybody comes back. Oh, excuse me. So with that, join the program just so you can get through it and you can now put some systems in place, use them to the end of 2018, 2019, get it started and build a practice. I know some of y'all know for years. I know you do good work, but I know you're doing a bunch of one-offs. And think about it. If you could get maybe 2 referral sources, or you could put together that introductory letter that you haven't done. Put together the brochure. We'll help you with those things. Clean up your website. Have a focus, a plan. Guess what happens? Now, suddenly, instead of sitting in the gym with all the other trainers who are sitting there at 2 o'clock in the afternoon twiddling their thumbs, you're now saying, hey, I got clients coming in because Dr. Smith, the therapist over there, is now referring clients. That's what it's all about. You paid top dollar for the MES. Let's now give you information to go use it and make a difference out there. Bridge that gap between healthcare and fitness. So, lastly, I said this years ago. It's amazingly true. It came back to haunt me. Exercise is the key in long-term management of most conditions. You guys know the exercise better than anyone else. What you've got to get up to speed on now is building the practice, putting the systems in place, learning how to market, learning how to communicate with medical professionals. That's what the mastermind is all about. All right. So if you're interested, go over to medical exercise specialist, medical exercise mastermindblueprint.com, get registered. And if you want to get a copy of this MET Medical Exercise Training 101, shoot me an email at drmike@postrehab.com, drmike@postrehab.com. And in the subject line, please put MET 101 ebook in the subject line. That way I know you stayed until the end of the program. So real quickly, Andre Granion is on the line right now. Andre is one of our MESs over in Austin. He comes over here and does our program, our stroke program, every other weekend. You may see some of Andre's videos out on Facebook where he's working with some of our stroke clients. Andre has been running our program. He's been doing some of the marketing for it. We've now got a full stroke program. We've got about 7 people that are in the program. These individuals are coming in. They're paying for the services. That's a signature program. Let me see who else we got. Joanne James. I think Joanne is on. Joanne owns Vital Steps in Toronto, Ontario. I've been up there a number of times. Joanne has a fitness facility, but she does more medical exercise training. She's got a lot of things going on in Canada right now with regard to medical exercise training and post-rehab, and her practice is growing. I've known Joanne now for, we did an MES course in Toronto in 1995 when I had hair and it was black. So I've known Joe for a long time. Michaela Munsterman, I told you about her. Hey, Michaela. Michaela just opened her facility in Austin, outside of Austin, and about 2,500 square feet. Not saying you guys have to do that, but it's the idea of going out there and talking to doctors, therapists, and chiropractors. Let me see who else. Tanya Johnson. I know Tanya's been at this for years. Tanya, I don't know if you have your own facility or not, but she's in Rialto, California. She does massage and exercise, and I know she gets referrals on an ongoing basis. I told you about Yuli and the things he's doing. Folks, this stuff works, but you got to put the systems in place. So if you're interested, go over to Medical Exercise MastermindBlueprint.com, get registered. That early bird lasts until June 19th. We start on June 26th. As soon as you register, I'm going to call you. I'll call you from Mexico as long as Vera doesn't get mad at me, and set up a time that we can meet one-on-one because we want to see you make this better. Folks, we're in a healthcare crisis. If you guys don't step up and figure this out, the medical community, we can't do it. We're already inundated. The insurance carriers are cutting us back, and there is an opportunity for you to deal with insurance companies. So if you have any questions for me, please email me at drmike@postrehab.com. And if you want that ebook in the subject line, put MET 101 ebook. I'll send you a copy of it. I think it's normally $19. We'll send you a copy because we want you to do that. All right. Let's see if I got any questions over here. All right, hold on. Let me put my glasses on. I can't see anything anymore. Somebody says, great presentation. Thank you. I do agree with you, Michael. I didn't post rehabilitation circuit. I want the medical exercise training. Okay. Let's see here. Totally agree with you. Expertise and experience matter. Yes, it does. Someone gave me the link to download the handout. Thank you, Rishi. I appreciate that. Words are blurry on the screen. Actually, the video, Ronan, will be much better than this. And I'll also send out the slides to you guys so you can actually get the slides too. Okay, so I'll send out those to you guys. We'll get those out to you tomorrow. All right. Anybody else have any questions? Let me say this in closing. Folks, when we started this 24 years ago, it was a dumb idea that we just kind of had. And when we offered the first course, I thought was we'd make enough money off the courses that myself and my physical therapy business partner could pay for our own continuing education. Well, I sold my portion of the clinics, moved to California, and we're driving across country, and we stop in Alabama, Anniston, Alabama. That's where we stopped. And I called to check the voice messages. We had 200 voice messages. I was like, what? This makes no sense. People were calling, hey, we saw your MES advertisement in the Idea magazine. We want to sign up. So I was really surprised. And we got to California, and we started doing more courses. Then we went to Canada. 1 year, I did 101 courses around the United States. And it's just gotten bigger. We now do courses via the internet. We've got folks from China, India, I think 37 countries now. This need is going to get bigger and bigger. And the only reason it's grown is because of the great work you guys have done. I say that in all honesty. I just had an idea. You guys took this thing, went out there and did a great job. So please, stop selling yourself short. Build your practices. I'm here to help you as best I can. Some of you I've met over the years, you know, you can call. I'll give you help as much as I can. But we got to now start to really lay the foundation for a new profession that now is going to sit at the table with other medical providers. So with that, I'm going to call it an evening. Again, you can email me at drmike@postrehab.com. If you want to call me, you can call 888-610-0923. And if you're interested in our mastermind, the early bird registration goes away on the 19th. Go to medicalexercisemastermindblueprint.com. And I'm going to tell you this, we're only taking 8 people. That's it, 8. More than 8, we can't work with very well. We're only taking 8. So I advise you, take advantage of the early bird fee, register, and again, shoot me the email. I'll send you the book. And I will say this. Oh, one thing I wanted to add. We have another certification called a Medical Exercise Program Director. All right? That's our program director. Okay? If you register for the MES Mastermind and you register before the end of the week, we will actually give you free registration or admission to our MEPD program. This is completely online. We're not going to send you the book. All of this is online. You can download it. And this MEPD program is how you manage the facility. So if you register for the Mastermind program, we're going to give you free admission to that, but only if you register by Saturday. All right? The reason I threw this in was because all the stuff is in here. We're going to download all of this, and there are a bunch of videos that go along with this, and we put this together so that if you wanted to manage a facility, you could have it. So you'll be able to get the videos online, you'll be able to download everything, but you got to register by Saturday at 11:59 p.m. So Saturday is June 15th. Yep. Register by the 15th of June, and you'll get that also with your registration. So with that, all the best. You guys have done a great job over the years. It's been a pleasure knowing all of you all these years. If I had to die tomorrow, I would say, you know what? I hope I've done something that's helped my fellow man. And I realized along the way, I was lucky enough to meet some great people that went out there and did great things for people. Because, folks, we see your blog posts. We hear about you all the time on the internet, and the stuff you guys are doing is fantastic. I am immensely blessed to have been part of a group of people who really are out there and really care about others. Thank you very much for everything you've done. Sincerely appreciate it. So if you have any questions for me, email me at drmike@postrehab.com. I look forward to seeing you in our Mastermind Blueprint program. With that Blueprint program, I didn't tell you, we got a private Facebook group. We got a series of conference calls and the Jumpstart webinar. So go over to Medical Exercise Mastermind Blueprint. You can read everything about it. The videos are there, and register. Take advantage of that early bird, and make sure if you register by Saturday, you get the MEPD program. All the best. I'm going to Mexico tomorrow. I've got a beautiful wife. I'm going to have a good time. Life is good, and I am very blessed. Blessed that you guys came this evening. I hope there was something I said that makes it better for you. Please go out there and use this stuff, and you're not just a personal trainer. You hold the key to what our healthcare system needs. Deal? Fair enough? Go use it. All the best to you. Thank you, folks. Have a good night. Bye-bye.